Hey guys, what's up? It's Alec Torelli, and in this video, we're going to talk about the 3 ways in which the coronavirus will disrupt the poker industry. As many of you are aware from my last video, I am currently in the north of Italy, just 24 miles away from the heart of the coronavirus outbreak. I believe that puts me in a unique situation to have foresight into how this is likely to play out in the US. If you haven't watched that yet, it's over on my other channel, Alec Torelli, which you could find below. I highly recommend you check it out, as I believe seeing firsthand the arrival of the coronavirus, how it has radically and rapidly changed life here, is a telling story of what's likely to transcribe in the US should this thing spread. Given that I have the foresight by being at ground zero in Italy, I believe it's my responsibility to raise awareness for what I believe to be a likely outcome for the poker community in the US as well as abroad. That said, I'm confident my analysis here applies to many industries, case studies of which are coming in my next video. Will the 2020 WSOP be canceled due to coronavirus? Be sure to subscribe and turn on notifications so you're alerted when it comes out. I believe it's going to be the most important piece of content I've released all year, along with this one, and I'd love to engage in a discussion with you on it. Finally, do me a quick favor and smash that like button for the YouTube algorithm. It really helps, and I'd greatly appreciate it. Now, before I jump in, let me say the obvious here. I'm someone who not only benefits from playing poker, but also runs a poker training site and has income derived from coaching and training products requiring people to play poker. So it's clear that the predictions I'm about to make, if true, would negatively influence me as much as anyone. I say this because I want my followers to know that my default bias is to not think what I have outlined below, but it's just what I believe to be true. Lastly, every fact and statement that I'm making in this video is backed by credible sources and can be checked for yourself in my blog at the link in the description below. I highly encourage you to check it out. Some of the things I'm about to share are also in video form at the link below, so you can see the experts on camera saying these things for yourself. All right, let's go. The coronavirus has taken the world by storm, now responsible for more than 90,000 infections and 3,000 deaths. The latest findings from the WHO put the death rate at 3.4%, outpacing previous pandemics such as the Spanish flu. It's my hope that the number is much lower based on the fact that there are some asymptomatic patients and others who aren't being tested, which, if they had, would lower the overall number. That said, until we know more, it's an unbelievably alarming statistic, and that alone should make those who compare this to the seasonal flu, which has a death rate of 0.01%, think twice. Sadly, it looks like the spread is inevitable at this point. The CDC says, quote, "It's not so much a question of if, but when this will happen, and how many will become infected." Unfortunately, coronavirus is easily transmittable, with each infected person having the potential to infect an average of 2.5 others. This means exponential, not linear growth. Einstein called exponential growth the most powerful force in the universe, and most underestimate and don't properly distinguish the difference between linear growth and exponential growth. So let me give you an example that highlights these differences. Imagine I start with $1 today, and every day for 30 consecutive days, I give you $1 additional dollar. How many do you end up with? 30, right? Now, most get that. Now imagine I do the same thing, but instead of growing linearly, your money grows exponentially. On day 1, you start with $1. On day 2, you have $2. On day 3, you have $4, and so on. In short, your money doubles every day. After 30 days, how much do you have? 1,000? 100,000? The answer is more than $1 billion. Can you see why this is a problem? One expert's opinion is alarming. Mark Lipsitch, professor of epidemiology and infectious diseases at Harvard, puts the most current estimates of COVID-19 to infect 40 to 70% of the worldwide adult population. It's hard to believe, so here's Lipsitch himself.
40 to 70% of the world's adult population could be infected.
It is a best estimate that I've been able to make based on a combination of the mathematical models that we use to track and predict epidemics. Whatever the number is, it's going to take a toll. If it really does spread as widely as that projection says, and that's what I think is likely to happen, then there are going to be millions of people dying, and I don't think there's any way to get around that.
This poses serious problems for healthcare systems worldwide, as we're already seeing in China, Italy, and elsewhere, but in particular in the US, where it's unclear if testing will be free and most people can't afford proper health and hospital care. Furthermore, it appears there's a severe shortage of mechanical ventilators, which are crucial in treating COVID-19. The New York Times reports that a study found that if an epidemic occurred in the States, we would need some 740,000 ventilators, but only 62,000 are available. In the description below, you can see firsthand how coronavirus is putting a huge strain on the Italian hospital system. In the article, Torelli, my wife, wrote, who is currently with me in Italy. In short, the director of our local hospital calls this a tsunami, stating that there are a record number of people in intensive care, and they had to build 3 new departments just to accommodate everyone. All this happened in the past 10 days. I'm not trying to instill fear here, but rather raise awareness that there is danger, and it's important to be aware of it so we can be better prepared and protect ourselves and our loved ones. Please help me spread awareness by sharing this with someone that you care about. All right, with that out of the way, the coronavirus poses 3 distinct threats to the poker world. Each one of them in isolation has the power to disrupt the industry for a period of time, but the likely convergence of all 3 of these simultaneously increases the odds dramatically. The first is the public response to coronavirus reducing demand for poker. As I wrote about in my recent article about the behavioral response to coronavirus in Italy, people will not want to gather in crowded places. I'm seeing this already here. Local bars, coffee shops, restaurants, and stores in our town have seen a severe reduction in traffic due to lack of demand and to the new measures put in place to reduce the spread of infection, such as bars and coffee shops closing from 6 p.m. to 6 a.m., and customers not being allowed to stand at the counter and having to keep 1 meter distance from each other. Of course, and especially in a quaint town like where I am currently staying, this is a strong hit for the small businesses, many of whom are already struggling in a stagnant economy. Some coffee shops decided to close temporarily until the virus subsides, and others are trying their hardest to attract clientele by turning lemons into lemonade, advertising the aperitivirus instead of aperitivo. Lack of demand for these staples of Italian culture is also an extreme measure taken by the citizens. As anyone familiar with Italian culture can attest, it's quite a sacrifice to give up your morning espresso and afternoon aperitivo, but people are doing it. I've been asked by many of you what daily life is like here in Italy, so close to the outbreak, and how it's changed since the virus hit. I'm working on putting together a vlog to share along with how this may affect you, so be sure to subscribe to my other channel at Alec Torelli on YouTube or at the description below to be notified when that comes your way. Nevertheless, the response here in Italy is telling of how people will behave if and when this hits their hometown. The question you must ask yourself is, what activity are people most likely to limit? It's my firm belief that discretionary ones, like poker, are amongst the first to go. Not only are they obviously unnecessary for survival, it's a tough sell for a husband, for example, to convince his wife and family that in the midst of a global pandemic, while the family is avoiding social contact and schools are closed, that he's going to the casino to punt a few grand on poker. It's just not happening. And what you have to remember about poker is the requirement for the ecosystem to function. In order for a game to run, several amateurs need to be playing, at the very least, for it to be worth someone's time. For a working professional, poker is usually a luxury, played on weekends, and in a crisis, it's the first activity one will avoid. The problem is exacerbated because poker is played in a casino, where the transferring of dirty chips and cash, as well as mandatory close proximity to others, makes it a thriving environment for transmitting coronavirus. More on that in a minute. In short, the demand for playing poker will be largely reduced. Poker is not the only industry which will get hit. Fear will set in and people will avoid crowds, meaning restaurants, bars, coffee shops, museums, movie theaters, etc. will all get hit too. I think people need to wake up to the fact that the coronavirus isn't merely a disruption in the supply chain in China, for example. It's a demand problem. The second reason why the coronavirus will disrupt the poker world has to do with living in uncertain times. Coronavirus is going to hit us in several ways from an economic standpoint with respect to the poker community. First, there may be less liquidity, but as I'll explain in a moment, that's not a fundamental requirement for people to play less poker. I originally started advocating this in late February, before the recent onset of cases were discovered in the US, that the coronavirus would impact the US stock market if and when this hit home. That actually began playing out even before patient 1 was discovered in Northern California on February 26th, but rather when the coronavirus started spreading throughout Europe. Imagine what happens when there's an outbreak in the US. I wrote about why the numbers will increase in my article, but in short, it's because we're not testing that we're not finding new cases. The CDC reportedly only test 450 patients as of a couple days ago, and they recently stopped reporting the numbers on their site. It's completely different than places like here in Italy where they tested some 15,000 or more. It's no wonder they're not finding cases in the States. Dr. Matt McCarthy, an infectious disease physician in New York City, went on CNBC recently saying they can't get proper testing done in New York City.
Let me tell you the problem right now. Before I came here this morning, I was in the emergency room seeing patients. I still do not have a rapid diagnostic test available to me.
Well, that's easy to do, is it not? Is it hard to manufacture?
It is easy to do for some countries. What happened in the United States is that the CDC created a test,
messed up a reagent,
sent a test out to 50 states, and then said, oh, hold up, don't use it, let us fix it.
How quickly
it's
can
now
we get
March.
on track now, Matt?
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. This is not good. The person who tested positive was only the 32nd test we've done in this state. That is a national scandal.
When the CDC helicopter drops 1 million tests as they promised over the next few weeks, it's inevitable the number of cases will increase. And even though experts believe we can only test between 10 and 15,000 patients a day, that's still enough to dramatically increase the number of infected patients that are being reported. Despite recent market dip and Fed rate cuts, I personally believe the effect of this hitting home isn't fully discounted in the stock market, and if equities draw back further, people will have less discretionary cash to gamble with. For those interested, there's a great short video in the blog post below which echoes some of my concerns and elaborates on this further. Now, this is not financial advice and only reflects my opinion. Ultimately, you'll bet on what you believe to be true. But what's important is not whether you agree with everything I'm saying here, but that you're aware that this is a potential storyline for how this plays out, and you're prepared for that reality. And nevertheless, like I said before, we don't need less liquidity for the poker world to suffer. Regardless of what you believe about the stock market, there's one thing I think we can all agree on. These are volatile times. In moments of uncertainty, the percentage of people whom are willing to throw down several grand on poker is dramatically reduced. Again, a completely discretionary activity for most is the first to go. They have families to support and they become significantly more risk adverse. The second way the coronavirus will affect the economy specifically is people simply having less income due to businesses closing down or by a reduction in revenue. This may happen because companies decide it's no longer safe for people to gather in large numbers at offices, or in the case of a service business, there's simply less demand from clients. A combination of other people spending less money due to their own financial uncertainty and not wanting to gather in public places. Again, it's a demand problem here. Both of these factors will combine and result in people playing less poker. The third threat to the poker world at this point is just casinos shutting down. With a mere 50 cases across the country of Macau, the casinos took preemptive measures by closing down entirely. They have since reopened, but with only half of the slot machines and tables allowed for use, and with the condition that all people wear masks. Not surprisingly, I'm hearing from a trusted source over there that the foot traffic is a fraction of what it used to be. This will continue until not only the threat of the virus subsides, but the economy stabilizes to a point where people feel comfortable allocating money toward a game like poker again. Furthermore, but not to be understated at all, Macau was able to reopen quickly because both them and Hong Kong took immediate and severe measures to contain the spread of the virus, which is yet to transpire in the US. If this happens stateside, plan for longer delays. It's not unrealistic to think that casino closure could happen here in Vegas or other places around the US, should the virus arrive there. Countries around the world have taken similar measures. France, for example, has banned large indoor gatherings, while Japan, Italy, and others are playing sporting events without fans. I believe personally it's very possible similar measures will be taken in the US and with casinos alike. They should be. It's the appropriate response. Now, I know the question on many of your minds is, how long is this going to last? Unfortunately, I don't have a great timeline for my predictions as to how long the poker bear market, if you will last, simply because there is so much unknown about the virus at this point. It's just too early to tell. Personally, I always plan for the worst case scenario, so I'm prepared no matter what. That's why my timeline is at least a year out. If things get better before, I just consider it a free roll. I urge others, especially those whose income derives from poker in some or all, to do the same. I'd like to reiterate that I really hope I'm wrong on pretty much everything I said before, but I believe it's irresponsible at this point not to plan for some or all of the events I listed here to transpire, if nothing other than a hedge. So what can you do? One immediate change you can make is to cut your spending. I have free worksheets available at the link below to help you do this by tracking every dollar you spend and cutting out everything that isn't absolutely necessary. While this may be especially helpful in a crisis, it's a prudent habit to develop as you will inevitably have both more options and reserves as well. For more information about the coronavirus and how to be prepared for you and your family, please follow the WHO and the CDC for real-time updates. If you found this video informative, I'd appreciate you take a second and like it, as well as share it with someone you know. That really helps. Thanks for your attention, and be sure to subscribe to my channel where you can see my next video where we'll discuss the potential cancellations of the 2020 World Series of Poker. I'll see you there.